got my vaccine against the COVID virus last week. No side effects. I haven't changed anything yet. I'm still wearing a mask everywhere. I'm still washing my hands, just a little less than Howard Hughes. I still keep a safe distance from my elderly parents when I go say hello in the driveway. After the first shot, I'm only about 20% protected. I'll go back for the booster 3 weeks later, and after a full month, I'm 95% protected from getting sick, and I'll dramatically reduce my chances of transmitting the virus to someone else. And why did I jump in and get the vaccine? The same reason we started our company that makes primary care easy and affordable for working families, because I see the catastrophic consequences of missing early prevention. I'm not a businessman with an MBA. I'm a frontline provider for critically ill heart patients, many of whom are COVID positive these days. I get my hands on the sickest of the sick every day. I constantly see missed opportunities that could have been taken to avoid costly and painful outcomes. Actions like physical inactivity, smoking, missing doctor visits, or avoiding vaccines. It's been almost a year since the pandemic began as I'm speaking here. There's still a great deal we don't know. When will the threat end? When will we be able to gather again? The uncertainty has created a unique mixture of panic and complacency. But now, we have something that could get us back to the way we would like to be in the world. Free, healthy, together. So you need to ask yourself, what are you most afraid of? The problem or the solution? Are you betting your resilience on radio and internet bloggers and sporadic observations who tell you to take vitamins, or better yet, a malaria drug that's never demonstrated antiviral activity in the 400 years since it was first used and studied? Here's what we know. First, vaccines have always scared people. The first were live viruses harvested from animals that scientists gambled would protect humans. And people took that gamble because the alternative was scarier. These new vaccines are different, but the concept is the same as it's been for 200 years. The technology behind these new vaccines, decades in the making, is the same that's currently curing birth defects, genetic diseases, and one day, maybe even cancer. Second, we'd never beat dangerous viral epidemics without vaccines. Smallpox, rubella, measles, polio, influenza, never. Last, unless the vast majority of us gets immunized, we will continue the way things are right now. The natural immunity to COVID only lasts a few months, and the recurrent infections can be more severe. The vaccine immunity so far has lasted much longer in the trials, which have included about 100,000 volunteers. With all this talk of we're in this together, this is something we can finally truly all do together, not just spout meaningless slogans. Look, in America, we don't like anyone telling us what to do. We're skeptical of anybody who says they have some special knowledge of what's best for us. But here's what else I know. Americans lead the way. We don't follow. We aren't anti-science. We're a magnet for innovators who come together and create the science. We succeed because we don't fear the chance of failure. If we don't act, there's not a chance of failure. There's a certainty. We've been through a great amount of division and trouble in the last few years that's shaken our confidence in ourselves and our way of life. But we're still strong and courageous. And we're still together. The frontline healthcare workers and the most frail and vulnerable of us are already showing us the path. Cor Medical will have the vaccine as soon as it's available. Please stay tuned to our announcements for ways to make your appointment. Stay safe and be well. Yours in good health, the Cor Medical team.